Hello and welcome back to the Healthcare Uncomplicated YouTube channel. Before I go ahead, make sure you subscribe to the channel so you get all these magnificent content every week with great leaders, global leaders to discuss healthcare technology and everything and anything in healthcare, and also acknowledge our industry partners. But today gives me great pleasure to introduce you to Ashis Barad. He's the Chief Digital and Information Officer at Allegheny Health Network. Ashish, how are you?
I'm great. So glad to be here, João.
Thank you for accepting my invite. I believe we have a very interesting topic today, and we're going to discuss the impending workforce crisis in healthcare. And the first question that I have for you is, how is the impending workforce crisis in healthcare expect to impact patient care and access to medical services in the coming years?
No, it's a great question and one that's near and dear to my heart. Again, as you said, I'm the Chief Digital Information Officer at Allegheny Health Network in Pittsburgh, Pennsylvania. And then we are owned by Highmark Health, which is a large company that also has a very large payer, the fourth largest Blue Cross Blue Shield in the country. And I say that because, to your point, we're tackling the problem and totality of just healthcare, of having a payer with a provider, and looking at all the different care models and the different ways that we could really tackle that. Plus, just the bigger problem also of the cost of healthcare in America. But to your point, I think that it's a really worrisome crisis that I spent a lot of time on. So I am a practicing physician. I'm a pediatric gastroenterologist. So I see it in my practice. I see it around me and my colleagues, and in the medical education system, which is that patients are getting sicker. They're getting older. They're getting more chronic diseases. They're needing more healthcare. And on the other side of it, and in COVID, we especially felt it and saw it. We have especially nurses, leaving the workforce or going into a different model with travel agency and what have you. But there's just not enough coming in for what the needs are, right? So there's a lot of statistics around this that we can go over. But I think, nurses were only the kind of the first wave of it. I think that we're still seeing that shortage. We're still seeing even other types of workers in healthcare, with radiation technologists to phlebotomists. It's not just doctors and nurses. But we know that we have the same issue with physicians as well, not just primary care physicians, but specialty physicians. So all of that, combined with the population that is needing more, is leading to what you just referred to as a crisis. And so I think that it's 100% where my mind is. Exactly, it's about the access to care, and it's about making sure that we have the right talent in the right spots, in the right areas to be able to engage those patients when they need it, both on the inpatient inpatient arena as well as the ambulatory arena. So I do worry about that. The answer, as you ask, how am I thinking through it, in many different ways, right? I don't think there's going to be one tactic that's going to really be able to solve for it. We're looking at all the way to the pipeline programs of really bringing people into healthcare, but at a very kind of a digital discussion level. I am very certain that synchronous care, one-to-one care, the care, even the virtual health is still mostly one-to-one care. As we have a conversation right now, is still taking me being here in person and you being in a different location. And certainly we can stretch geography and really take that out of the equation, but this is still a one-to-one care. And I think that we're going to have to really lean on asynchronous care. To your question, is if we don't have as much of the workforce, then how can you do things through digital tools and virtual tools that allow us to really then think about providing care with to an individual that's personalized, that's trustworthy, that's engaging them in a way that allows them to still receive the care they need, receive the advice they need to receive the access and navigation they need, but in a way that's coming from their care team, so they trust it, but is not utilizing the care team resources at all times. So I'm looking at a role and working on building a role in which that asynchronous care is connected to the to the care teams and to that care that they have trust with, so to be able to really create that model that allows them to escalate to that care team when needed. So
Brilliant.
long answer, but it's a multifaceted problem.
Yeah, it's a big challenge. Thank you so much for being, I mean, specific, but also very targeted in the approach. And unfortunately, Ashish, as you well know, is a global issue. It's not just in US, it's not just in UK, it's in
That's right.
Europe, is a global issue. The shortage of professionals, healthcare professionals. Moving on, what specific challenges and factors contribute to the workforce crisis in healthcare, and how are healthcare organizations addressing these issues?
Right. So no, it's again a great question. I think that we are looking at this again in many different ways of how we truly address the problems that are creating this burden on our care teams, and it's creating a lot of burnout issues and workflow issues. I think it's both. We have a lot of the care team members that are leaving healthcare. We also, as I mentioned already, I think the funnel is not quite as robust as it used to be. I always think about when I was a kid. Everybody wanted to be a doctor or a nurse. You don't hear that so much anymore. I think my son wants to be, either help, but whether it be Instagram or TikTok or YouTuber, there's nothing wrong with it, right? So, but right, those are the things I hear from my, more so than I say, oh, I want to be a doctor. So I do think even culturally, with COVID and the misinformation and the vaccinations and everything else, it has really kind of put a little bit of a bad taste in some people's mouth about the healthcare and the trust and everything else. So I think we have some work to do just at a very, broad level, but very more tactically. I think that the burden and what I can control at this moment in time within the health system, and being overseeing the EMRs and everything around it, is that the burden that's on the care teams and the amount of time they spend away from a patient is
Mm.
profound. It's profound. We did a reimagined nursing project, this about a year ago, and we spent 1,100 hours with the nurses at the bedside, with the whole team that really spent, I mean, just documenting every minute, every hour, everything they did. And 50% of an inpatient nurse shift, a 12-hour shift, 6 hours was spent on documentation.
Wow.
And then, only about 10 to 15% of time was on direct patient care. That's a problem. That's a major problem. And so then you look at this workforce and you say, well, do we just hire more? Sure, let's have more people come into the system. Let's bring them in, but we have to change that number. We cannot have them spending so much time. So as I look at the space, for example, right, with ambient clinical intelligence, right, as everybody, generative AI comes into the picture, and we see these tools come in, I think it is absolutely profound, and that's one tactic that we're looking at, to say, how do I remove the keyboard? How do I remove documentation burden off our caregivers and give all that time back? And that time back, I will be careful, because some may look at that time back as that will create access and that will increase productivity. I want to be thoughtful and careful, because that may happen, but really that most of those time back, most of those hours are spent as what we call in the industry pajama time, right? It's the evening, it's the weekends, it's after work. And to be able to give that time back to really spend, on quality time with family or what have you, is something that we're working actively on, and I think that at least is one factor that could play well into helping our workforce.
Oh, brilliant. Thank you so much for
And that's not
highlighting.
just, and by the way, sorry, that's not just physicians, by the way, and I think that's important, that we cannot just solve for physicians only. It has to be nurses, but it also needs to be or other ancillary staff that's also
Mm.
burden. And I think sometimes we focus a lot of that discussion on physician documentation burden, which is absolutely a problem. But I think it's very important that we expand that scope.
Hmm. Ashish, thank you so much for highlighting the real, I mean, the real problem on the ground. And you made me laugh when you mentioned your son. No, the kids, they don't mention being a doctor. My son also mentioned the YouTubers, the Mr. Beast and all that stuff. You make me laugh when you mentioned
That's
that.
right. That's
Yeah,
right. That's
but
right. Yeah,
it's the
absolutely right.
reality. But
With 1 billion viewers,
yeah,
right? You know, you talk about scope.
yeah.
Yeah.
But going back to our fundamental issues in healthcare, you are right. Of course, we have a lot of hope now with generative AI and other tools, but that reality that you mentioned, I always go back. You know, I'm based in UK, but I always go back to this last example. I had a consultation with the doctor face to face. First, it was very difficult to find a booking. But then I spent 8 minutes face to face, and it was 8 minutes because I actually mentioned my history because they didn't have a proper updated medical record. So I had to say I had asthma in the past. So I think out of these 8 minutes, I spoke 3 or 4 minutes about my history. Otherwise, I would have 3 or 4 minutes of, and that's a very harsh reality, you know. And you can sense that something is actually wrong because they're trying to almost get you out of the door. As if it was like a car wash, which is a very bad experience, unfortunately. Yeah? As if he was like as if he's like a car wash. I don't know how to describe the experience. Was like, okay, I'm talking to you about this little infection, but uh, the system is not here to kind of give me some kind of comfort. It's kind of just what happened, what, how are
And I
you, who are you, and let's get on with things. Yeah,
and I
it's
think I think that that's like what you're talking about is really an important point, and one that I don't think there's one solution to exactly what you're saying. However, what I will say is the model of financing system, and I can't speak to the UK as well as I can to the US healthcare system, but obviously there's been a lot of discussion about fee for service to value based care, you know, in the way that the reimbursement model is. And so in a fee for service world, and I was been a fee for service doctor for most of my career, it to your point, not to, that I ever actively go into a room and think car wash or think how do I get you out of the room, but the model is when you have visits that are every 10 minutes or every 15 minutes, it's certainly by the time the history gets done and I'm running late from the other one, I'm trying to catch up with my day, right? And then there's a fact that just boggles my mind. For every visit, it takes a primary care doctor 16 minutes to document that visit, which is often 15 minutes. So the doctor's also, and the provider's also thinking of, I have to document all this work that I'm just spending time with you
yeah,
talking. So you're right. It creates this model of care that I don't think anybody's happy with.
yeah,
Right. And so our hope is that, in here at Allegheny Health Network, as being that we're a payvider, is that we're changing that model and spending a lot of time with our primary care teams. So I'll give you a very perfect example. Our primary care docs, most of them have transformed into a team-based care. And so now when you come in, and you may not always need to see the doctor, you may really have medication questions and you meet with the pharmacist. You may have health questions and you meet with a health coach. You may need more anxiety related issues and you may need a behavioral, and go on and go on. And then the doctor really gets to be the kind of the over quarterback of your care and looking and coordinating and spending enough time that they need to with the patients that are the highest risk or highest needs that really need that time. So I think that you're 100% correct that the model that we have needs to be adjusted to what I think everybody wants, which is really to focus on the health of the patient. And
yeah.
that takes time. That takes time with the patient.
Yeah. Moving on, Ashish, the third and last question I have for you is in what ways can technology and innovative solutions be leveraged to mitigate the impact of the impending workforce crisis in healthcare and ensure a sustainable and resilient healthcare system?
Yeah, it's a great question and a very complex question, right? So, I hope to have part of the answer to that because I think it's something that we're all thinking through. I think that, as I said, I do think that we, at a fundamental level, need to reduce the burden on our workforce, and not just documentation, but just all things, right? And there's a lot of work happening around, in basket messaging, what have you, to really then allow time back with the patient and, turn that chair around and really spend it with the patient. I think, additionally, whether it's the journey, remote patient monitoring or wearables or asynchronous care, but some level of being with patients, 24/7, and really being a surrounding system around them to really engage them when they need care, right? I think that, um, I hope that I'm a good doctor in what I do when I take care of somebody. When I'm in the room with that person, I'm with them, and I hope that I really engage them and give them that comfort of knowing, whatever's going on with their condition, whether they have Crohn's disease or, reflux, that I'm really engaged with them. However, right, we know the reality. Once they walk out of that door and I go to the next patient, I'm focused on that next patient. And that patient, if they go home and they have issues, yes, I give them a number. Yes, I give them an in-basket message, my chart message. Yes, there's the ED. That is not the optimal setting. What they really want is, hey, I have a question, I have an issue, and they really want to hear what I have to say about it. But that, right, I cannot be on 24/7. So I think of technology in a way of how can I build a technology ecosystem, a platform that can be with them 24/7, but that information that they're receiving, the patient is receiving, the consumer is receiving, is still trusted and is coming from their care team that they trust, right? Because I think that a lot of times what we see right now is a lot of information that's very generic, in a very just general kind of answers to what should I do because I have hypertension. It's great. Health literacy education is wonderful. But a lot of people really do want personalized advice. And if they don't get that, then they could go back to the old system, and then it goes back to the other emergency rooms or wait for appointments, and then they don't have access to those appointments oftentimes. So I think building an ecosystem that really surrounds the human touch, the care that they receive, and then really creating digital tools and virtual modalities around that is how I think of the coming age. I don't think it's going to be a separate digital world here and a separate brick and mortar physical world here. I think that we have to do the hard work of integrating the two.
Brilliant. Ashish, thank you so much. Look, we're coming to the end of the episode. I want to really thank you for your time, for this amazing expertise, for your insights, and of course, your contribution to the industry. I have one last little item for you. I expect a very short answer, which is like probably the $1 million questions. It's related to the channel. How can we make healthcare uncomplicated?
Whew. How can we make healthcare uncomplicated? Yeah, you said short answer. We put the patient, the consumer, the person at the center of it, and we focus on them.
Brilliant. That's a fantastic way to round up. Ashish, once again, thank you so much for your input. I want to thank you for your time. Thank you for being available and everything. And I'm going to round up now. Thank you. And nice to see you, of course.
Nice to see you too. Take care, everybody.
Thank you. So, to all our viewers and listeners, make sure you subscribe to the channel, acknowledge our channel partners, and I'm going to post Ashish LinkedIn and some connections in here. Make sure you connect with him, ask questions about the industry and about these challenges that we are facing. And I'll see you all next time.